Everyone for joining us this morning. It is International Women's Day, and we are delighted here at the Paid Leave Authority to host this rally in support of paid leave. The purpose of today's program is for you to hear from the voices of men and women for whom paid family and medical leave would have made an enormous difference in their lives had it existed at the time that they really needed it. So I am really very happy to have all of you here today. I am Andrea Barton Reeves. I am the CEO of Connecticut's Paid Leave Authority. And we have a wonderful attendance today and a program for you. You will hear directly from people so that you can understand the value of paid leave. But before we begin, I would like to recognize and introduce the state's Lieutenant Governor, a wonderful supporter of paid family and medical leave, the leader of the Council on Women and Girls, the Honorable Susan Bysiewicz. Thank you, Lieutenant Governor, for being here.
Thank you so much, Andrea, for your leadership, and good morning, everyone. It is such an honor to join all of you today for this very important topic, and especially on International Women's Day to highlight Connecticut's landmark paid leave program, which launched earlier this year in January, and to talk about how we can build on these efforts to make our state the most female-friendly and family-friendly in the country. This law was passed back in the 2019 legislative session, and it's going to provide up to 12 weeks of replacement wages for workers who have to take extended time off for personal illness or to care for their loved ones. And I think this COVID-19 pandemic has really highlighted how critical this is. And it has also laid bare the inequities and disparities that exist in every aspect of our society, from access to quality healthcare to education to employment. And we can't defeat the spread of the virus if we don't have the ability to take time off, to isolate, to quarantine, or to care for sick loved ones. And that's why I'm so excited that Connecticut has continued to lead the way. And it's why, since the governor and I have taken office, we've been incredibly focused on advancing priorities for women and families, because at their core, women's issues are economic issues. And one of our top priorities has been to bring together every one of our cabinet secretaries here in Connecticut to talk about how each of our state departments can act in a very coordinated way to address the needs of women and girls. And last week, we announced our legislative agenda. One of those 6 bills had to do with making sure that more women can run for elective office, because we won't have family-friendly policies unless we have more female leaders. And I wanted to give a shout out to Caitlin Pereira, who's one of the female candidates that brought to our attention the fact that our Connecticut state public finance program didn't provide for childcare expenses as an approved expense under our CEP program. So we hope that the legislature will change that. We also want to make sure that employment discrimination, particularly against our older women workers, is addressed in our state. And that's why we are supporting legislation that would remove from job applications the dates of birth or dates of graduation or dates of employment that would let employers know what a person's age is. And we want to add reciprocity so that the spouses of the many military workers who move to Connecticut have the opportunity to have their licenses recognized, whether they're a realtor or a nurse or in some other profession, 90% of the military spouses that come to our state are women, and there's a very high unemployment rate amongst those women because their licenses for teaching or nursing or other medical professions aren't recognized. So these are just a few of the things that we are hoping to change. And I want to thank Andrea and the team at Connecticut Paid Leave for being so successful in getting 2/3 of our employers to sign up. We know the work isn't done. So if you know of a business out there who hasn't registered, please let them know that they have an opportunity to register now so that their employees can participate in this critical program that's going to keep our families and our state safe. So thank you so much, Andrea, for having me. And I'm looking forward to hearing some of the stories of the working women who've joined us today.
Thank you, Lieutenant Governor. Thank you very much. I'd like to acknowledge Representative Jason Rojas, who's joined us here today. We actually will have another event next week, which is a roundtable for legislators so they can tell their stories at the state level about how paid leave would have been very beneficial to them. And Representative Rojas will be one of those parents who will share her story. So welcome today, Representative Rojas. So we know we have paid family and medical leave on the state level, but we also have an advocate, a champion is really the better word to describe her, who's moving forward with paid family and medical leave at the federal level. And that is the fabulous Congresswoman Rosa DeLauro, who has joined us here today so that she can speak about, well, her efforts to make paid leave possible in the state of Connecticut and how she continues to fight for paid leave at the federal level so that every worker in America can make the decision to be with their families without the loss of pay. So welcome, Congresswoman DeLauro, and thank you for being here today.
Well, thank you so much. And thank you, Andrea, for all the work that you are doing. And to our Lieutenant Governor, thank you for being, such a leader of this effort. And both of you never flagging for a moment to make sure that this is what it needs to be in Connecticut, and for being helpful in terms of advocates at the federal level as well. I'm inspired by the smart, the strong, and the committed women leaders as we do celebrate International Women's Day and recognize the contributions of women like all of you throughout our history during this month. And it's not only during this month, which we should celebrate you, but always for the great work that you do. You have served as champions for working families, and you have delivered again and again in ensuring that the workers in Connecticut have access to paid family leave. And today is something that we want to try to do, is to build on that effort. Connecticut, and I say with such great pride, leads the nation in so many family-friendly policies. It's the direct result of hard work, compassion, driven by both the private and the public sector, including business owners, employees, healthcare professionals, and public servants. You made this happen. We would not be celebrating today if it were not for all of you. In our federal system, our states serve as laboratories for sound policy making. And the bright ideas that start in the states serve as a model so that the Congress can take up and look at a national standard. And that's where this impetus at the federal level is coming from states like Connecticut. Connecticut served as the blueprint for family and medical leave for America. It was here, 1987, that the first ever state family and medical leave legislation in the country became law. That became a model for the National Family and Medical Leave Act, including champions like former Senator Chris Dodd in the earlier days on this in the legislature. John Larson, my colleague in the House of Representatives now, was a pioneer in this effort. And it was in Connecticut in 2011 that Governor Malloy signed into law paid sick days. Here in 2019, when Governor Lamont signed into law paid family and medical leave. So we should be very proud of our contributions, but we don't take it for granted. None of us take it for granted. Progress and change do not come through pride, but through a serious evaluation of the many hurdles that we as women still face across this country, even more so as the pandemic continues to expose very deep economic inequalities. A report from the Center for American Progress estimates that, and I quote, "The risk of mothers leaving the labor force and reducing work hours in order to assume caretaking responsibility amounts to $64.5 billion per year in lost wages and economic activity," end quote. A separate survey of households gives us more painful insight into these figures, as it was Black women and Latinas who lost their jobs, while white women made significant gains. Women of color not only work in some of the hardest hit sectors of our economy, they are more likely to be employed in roles that lack paid sick leave and the ability to work from home. This is simply unacceptable. We took a first step for a national standard for paid leave in the emergency relief package last year, but it was far too narrow and it expired in December. More than ever before, we need a permanent, self-sustaining, comprehensive solution that allows all workers access, and so no one needs to choose between taking care of themselves or a loved one and a paycheck, which is why really since 2013, myself and my colleague in the Senate, Kristen Gillibrand, we have fought for the Family Act. It builds on Connecticut's progress and creates an independent, self-sustaining national insurance program, which would give all workers access to paid family and medical leave. From the fund, eligible employees could receive up to 60 days, 12 weeks of partial income if they need to take time away due to a health condition, pregnancy or childbirth, injury or sickness to a child, parent, spouse, or domestic partner, the birth or adoption of a child, the injury of a family member in the military, or other reasons arising from a service member's deployment. Amazingly, only a decade after women won the right to vote, and I want to read this to you, and I will wind up with this. Where do we stand now? A paid family and medical leave is not part of the relief package that we are going to pass. The Senate passed it over the weekend. The House will pass it again tomorrow evening, and the president will sign it. Paid family and medical leave is not in that bill. Reason why is because we could not mandate anything in the mechanism that has been used to get us by the 60 vote filibuster that you need. In order to be able to just go with a simple majority, we had to employ a different mechanism in terms of being able to get the legislation passed. But we are talking with the administration about in the next package, in the recovery package, to include both the funding and the mandate for paid family and medical leave. So I will wind up with this. Only a decade after women won the right to vote, and I'm going to quote my mother. She wrote in the 10th Ward Democratic newsletter in 1933. That was 76 years ago. My mom passed away just 3 years ago at age 103. And this was her quote in 1933. "We are not living in the Middle Ages when a woman's part in life was merely to serve her master in her home. But we have gradually taken our place in every phase of human endeavor, and even in the heretofore stronghold of the male sex politics. I have noticed that the girls, unlike the men, are timid in asserting themselves, and many a good idea is lost, having been suppressed by its creator. Come on, girls, let's make ourselves heard. You here today will help to make this happen. You are the next generation of women in politics. You're going to lead this nation into the future. And so I'm so grateful and thankful for you allowing me to be here and to share a few moments with you. We are going to get out there. We are going to make ourselves get heard. And I will just tell you that I believe, and I'm I'm not naive in this business, but with this new administration, that we are going to see a national standard for paid family and medical leave in this country, which is revolutionary. Thank you all for what you do. Thank you for allowing me to share this morning with you.
Thank you so much, Congresswoman DeLauro. That was inspiring. It's the only way I can describe it. Thank you very, very much. We are going to change the order of our program a bit, and I'm going to ask Colette Fennessy to share her story. And then after that, I will ask Adrienne Cochran, who's the CEO of the YW of the Hartford region, to speak immediately after her. So Colette, if you wouldn't mind coming to the virtual mic and sharing your story this morning.
Thank you for having me. Hi, good morning. My name is Colette Fennessy. I'm an engineer for Raytheon Technologies. I live in West Hartford. My family is a foster and adoptive family through DCF. And at the time, my wife had to take unpaid time off from work in order to care for our new foster baby. He was a high risk, medically complex baby that needed a lot of attention. So, she had to choose between a steady paycheck for our family and bonding with our new baby, that a choice no parent should have to make. Foster care is so important in our state. I really hope that this law opens the door for new potential foster families who can share their homes with these at-need children. This law, will give these new foster families peace of mind so that they can really focus on caring and bonding for the children that really need it. So thank you for having me here, and I'm really excited for Connecticut. Thank you.
Well, thank you for that. And I do hope more families step forward for foster and adoption. I really do. So thank you very much for sharing that story. And today, I would also like to introduce Adrienne Cochran, who is the CEO of the Hartford region, the YWCA, I should say, of the Hartford region. Adrienne is one of those very quiet leaders. She is actually a licensed clinical social worker. She also holds a law degree, and she ran the Urban League in Hartford for 7 years, bringing it back into its fabulous prominence. And she's done that across the country for a number of urban leagues. She has been the CEO at the YWCA for the last 3 years. And in recognition of her leadership, she was only one of 2 organizations in the state of Hartford that received a multi-million-dollar gift from Mackenzie Scott, unrestricted, to do the work, the critical work that the YWCA does. So with that, I welcome you, Adrienne Cochran, and also welcome you to the virtual mic to share what your organization and what you're doing for women and girls today. So thank you.
Thank you so much, Andrea, and thank you, Lieutenant Governor. Thank you, Congresswoman DeLauro. It is so exciting just to share this International Women's Day with each and every one of you, and to thank you all for being such tireless advocates for work that you do every day. Andrea, I can't say enough about the fantastic job that you are doing. I will join that chorus in saying that you have stood up this authority and done this work, hiring an amazing staff in very short order. So kudos and congratulations to you as well. We're certainly fortunate to live in a state that has such a progressive and expansive definition of family. And I will tell you that when Senator Looney approached me about becoming a part of the authority, and I was one of the first appointees, he even had no idea how personal this story was to me and how important this work at YWCA Hartford Region would be for me. So what I will share with you is that the day after Thanksgiving, November of 2017, my father was diagnosed with stage 4 pancreatic cancer. No one knew at that time. Of course, it was a death sentence, but no one knew at that time how long he would live. As it is, he died peacefully, fortunately, on February 1st of 2018. Now, for that period in between, with my mom having predeceased my dad, and with me being an only child, my father living in a southern state, it was critical for me to be there with him. And I was. I was fortunate that the organization that I was leaving at that time, as well as the YWCA, which was gaining me, were both understanding of this. there was no paid family leave. Now, while there was no doubt in my mind about the choice I would make to be at my father's bedside throughout this period of time, I think back to all of those who may not have been able to make such a choice. I think about the wonderful women and men that I work with every day at YWCA Hartford Region. I think about our staff. I think about the families. I think about women. You've heard the Congresswoman talk about the dismal stats. The She session saw so many women leave the workforce for all the reasons you heard. They were me, except they were being forced to make a choice. And some cannot make that choice between being with a family member and having to maintain their work, about wondering what might happen to them when they tried to return to work because they had to be away for some period of time. We have legislation now that says you don't have to make that choice. And for Black and brown women and women of color and in communities of color, that is absolutely crucial. So the YWCA Hartford region is always going to stand tall, stand strong for making sure that we are doing what is right for women, for girls, for families in our communities. And even though the statistics are daunting, we know that these are not just statistics, they are women. They represent girls, they represent families that many times lose greatly in a choice that no one should have to make. So I'm indeed proud to be here today. I am proud to be a member of the board of this authority, and I am proud of the work that is being done and has been done in this state. And YWCA Hartford Region will continue to stand strongly and very resolute beside you, Lieutenant Governor, Congresswoman DeLauro, in all of the important work that you do. Thank you for this opportunity to address you this morning. And again, happy Women's Month and happy International Women's Day. Thank you, Andrea.
Thank you, Adrienne. Thank you very much. Thank you. Next, I'd like to introduce Ashika Brinkley, who is on the board of the Connecticut Women's Education and Legal Fund. Ashika, I have a lot of people on my screen, so I can't necessarily see you, but there you are. So welcome. We all know the extraordinary work that QUELF has done as a leader in making paid leave possible in the state, leading the coalition of over 100 organizations that helped make paid leave a reality in 2019. So we welcome you to say a few words about QUELF's role and any personal story that you'd like to share about the paid leave law. Thank you.
Thank you, Andrea. Good morning. Good morning, everyone. My name is Ashika Brinkley, and I'm the board president for the Connecticut Women's Education and Legal Fund, QUELF. Thank you to the Lieutenant Governor Bysiewicz, Andrea, and the Connecticut Paid Leave Authority, Adrienne, and all of our partners here today. QUELF is a statewide nonprofit organization that advocates for and empowers women and girls in Connecticut, especially those who are underserved or marginalized. We are very proud to lead the campaign for paid family leave, a coalition of more than 75 organizations that fought for and won passage of paid family and medical leave in 2019. I am so proud to be here with you all on International Women's Day, a day that celebrates the social, economic, cultural, and political achievements of women across the globe. Prior to the pandemic, and during the campaign's advocacy efforts, we heard year after year how critical access to paid family and medical leave is to women in our state. We heard the stories of new parents who returned to work too soon after giving birth to a baby or having a baby, and from those who wanted to be there for a terminally ill parent or loved one, but couldn't, simply because they couldn't miss their paycheck. We heard from workers who needed to care for a loved one who was like family to them, but realized that they were not covered under the law. The impact and benefits of paid family and medical leave are far-reaching, and as COVID-19's public health emergency continues in our state, we know that this program is critical now more than ever, especially for women. COVID-19 has uprooted the lives and economic security of women, especially women of color in our state and nationwide. Women continue to shoulder the majority of caregiving responsibility at home, and at the same time, we are overrepresented in jobs on the front line of the pandemic and in industries experiencing the highest number of layoffs. These are the industries that often lack access to paid sick leave, family leave, or a livable wage. Recent data from the Connecticut Data Collaborative, the Aurora Foundation, and funders of the Connecticut Collective for Women and Girls illustrates the crisis women in our state are facing between work, caregiving responsibilities, highlighting the collapse of an already fragile system in care of our state and the importance of comprehensive, inclusive, and accessible paid leave. The report shows that nearly 1 in 3 families have not been able to find quality childcare during the pandemic, and of Connecticut parents who report having to stay home and not work due to childcare in the fall of 2020, 76% were women. When Connecticut lawmakers passed paid family and medical leave in 2019, no one could have predicted a global pandemic and the severe economic burdens it would place on families and on workers and their families. Connecticut's recovery from the COVID-19 crisis must include successful implementation of the state's landmark paid family and medical leave program. The COVID-19 crisis has made abundantly clear that workers should never face the impossible choice between their health, the health of a loved one, and their paycheck. We are so proud to be here today with so many amazing women highlighting the importance of paid family and medical leave and celebrating the progress that we've made to make paid leave a reality here in our state. Thank you to Andrea and the Paid Leave Authority for all of your hard work to move us forward this year and to put to life what so many folks on this call and beyond have fought for year after year at the legislature. Thank you to the Lieutenant Governor and Governor Lamont for your commitment to the implementation, even through these difficult times. Lastly, thank you to all of our partners, advocates, and workers. Your stories propelled this issue forward, and because of you, we are here today. Thank you all.
Thank you so much, Ashika. And again, thank you to Quelf and all of the advocates that made paid family and medical leave possible. We are continuously grateful to you for all that you have done. Next, I would like to introduce Elise Bermudez. Many of you know her. She's Councilwoman Elise Bermudez of the City of Hartford. She has been a tireless advocate for the Connecticut workforce for many years. She comes from a venerated family of people who are advocates, and we're very excited that you chose to join us today, and we appreciate the time that you've taken. So I will just turn over the mic to you and ask if you would share. And again, thank you for being here.
Thank you so much for having me, and thank you for your tireless work. My name is Elise Bermudez. I'm on the Hartford City Council as an elected official. And I am so happy that we're having this critical conversation today, because this paid leave is not only, thankfully we passed it, but it is so needed, so very much needed in our state, because it is talking and addressing protecting women and families. And that it's at the core of what we're discussing here today, protection of women and families, especially during life-changing events. And for many folks, that has to do with medical life-changing events. And in my case in particular, that was what I endured when I was pregnant. And so when I was pregnant several years ago, I had to make sure to save some additional money to be able to take some time off from work, unpaid, of course. And at that moment in time, there was no paid leave. I wish there had been. But the reality is that for many women then, it was unfathomable, right, to have to be able to save up enough money to take unpaid time so that you could care for and be there for your newborn child. And during the birth process for me, it led to medical complications, which meant actually that I had to have an emergency C-section. And as a result, my recovery time was actually extended. So what could have been a natural birth ended up being a prolonged recovery period. And so with that complication, it meant, of course, that I had to take an even longer stay out of the workforce for that time. So imagine that reality then overlaid with the reality of the pandemic that we're living in right now. I have a friend of mine who is a teacher in the greater Hartford region. She teaches high school students, and she is pregnant right now. And unfortunately, she has COVID. And so she has to take time off. And so thankfully, with the reality that we're in, and thanks to all the work of tireless advocates, we do have paid leave, and we are able to confront this pandemic in a way and help those most in need during these life-changing events. And so my friend will be able to benefit in that way. But at the same time, we recognize that there continues to be many more folks who need to be informed on this issue, and that's through the work that you're all doing today and that you'll continue to do for weeks and months to come. And so while we are very excited and we celebrate today's the special day that is today, we also know that we continue to do more work along the way. And so I'm grateful for being here with you and grateful to share this important, critical time that we're in to highlight the importance of paid leave in Connecticut.
Thank you very much. Thank you for sharing your story. It's again, it highlights the criticality of why paid leave matters to everyone. So thank you for telling that story. Next, I would like to introduce Lyna Harris. Lyna, again, I have a lot of people on the screen. Thank you all for being here, so I don't see you.
Here I am.
There you are. You too, if you don't mind stepping up again to the virtual microphone and sharing your personal story and telling us why paid leave would have made such a difference in your life. Thank you.
Okay, hi, yes, good morning. Happy Women's Day, everybody. My name is Lyna Harris. I'm a fire sprinkler inspector for Johnson Control. I'm actually out in the field right now at UConn Health. I'm one of the ones who make sure you guys buildings are fire safety and everything is up to code. I'm gonna be short and sweet, but when I first got custody of my niece, like I had a lot of time where I had to go to court a lot and to take her to do different things, and I had to take out a lot for work, and I ran out of time, and I end up like footing the bill without no paid time off, and so I think this is a awesome thing, to help us not give up, it's not a lot of people out here to take in our foster kids, and it gives up hope sometimes when you don't have the money and the funds to take care of things. So sometimes you give up, but this is to give hope right now, and this feels good, and this is awesome.
Thank you for that. I think I do want to say this, that the stories, especially about foster and adoptive children, are really close to me, because I too am adoptive parents, and I know that story, and I've walked that walk with for so many years. And I represented kids who were in the child protection system for a long time too, and have seen hundreds of families. So I know exactly what you speak of, and I really appreciate the fact that you are sharing your story here today. So thank you for that. And we're going to keep fighting for paid leave. So the next time you want to be an adoptive or foster parent, it'll be a little bit of an easier walk for you. So thank you.
Okay. Thank you.
So next I'd like to introduce Stephanie Johnson. Stephanie, I'm not sure where you are either.
I'm
but
here.
There you are. Okay. So Stephanie, please tell us your story and why paid leave is critical for you.
Thank you. I'm just, first of all, happy International Women's Day. I am honored and humbled to be a panelist here with the Lieutenant Governor and Congresswoman DeLauro. I think that women are amazing, and I think that our ability to morph into whatever is necessary for our families is amazing. I like to tell my story as a tale of two children. So I lived in Rhode Island in the 90s. That sounds so far ago. And I had my first son. My first son, Stefan, was born after many, many hours of labor. I ended up having a C-section. Rhode Island actually had temporary disability insurance. So I was able to be out for 12 weeks and receive my pay. The time that a mother has to spend with her newborn is priceless, and you never get it back. So every moment that I could take with him, I wanted to. So I was allowed 12 weeks of paid time. I worked for a company where you couldn't carry over your sick time or your vacation time. So that was pretty much all I had, was the paid family leave from the state of Rhode Island. Fast forward 4 years later, I had my second son, Noah, and again, had to have a C-section. He was planned. So that automatically takes your leave from 6 weeks to 8 weeks. And that depends on how well you're doing. I had been working for the hospital. I work for Lawrence and Memorial Hospital in New London, which is now part of Yale. I worked for them for 2 years, so I didn't really have a whole bunch of time saved up. And what I ended up having to do was go back to work early. And that was not part of what I wanted to do, but financially I had to. Dad worked out of state, so we were juggling it the best we could, but it just would have been an impossibility for a single parent to have to endure that. I don't know how you get the bills paid, keep the lights on, have food on the table without paid family leave. And right now I'm actually out on leave, and it's nice that we have it. We can't use it until next year though. So I am out on leave right now for a neck surgery, and I had COVID. Now, being in the healthcare profession, we hear the COVID sorry stories. Mine wasn't nearly as bad, but I was down for about 2 weeks. Had we had this in place before, I would not have had to worry about whether or not I had enough vacation time saved up, because while you're out, you still have to pay for your benefits. So it's an impossibility sometimes to meet all the demands, but somehow we make it work. And I'm fortunate to not be a parent that is making less than what the poverty line allows. I'm very, very fortunate to have the position that I have, to make the money that I have, because then I was able to make it stretch. But it just would have been really, really good knowing that I could lay back on that and have the paid family leave and not have to worry about the simple things. So I am always going to advocate for this, because like everyone has said, it's usually the woman that takes the brunt of everything when it comes to raising of children, taking care of children. It's usually the woman, not always, but maybe about 75% of the time. So I will always advocate for this. I will always speak in favor of this. I think this is a justice that needs to be given to the women of this country. I will do everything that I can to make sure that it goes forward. And I just thank you for letting me be a part of this. It's a remarkable thing that Connecticut is doing. It's not easy. I've had people say to me, oh, great, now we're going to have to pay for everybody's fill in the blank. And I was like, no, this could be you one day. And you don't understand. And you're lucky. You're very fortunate that the person that actually said this to me, I'm like, you're very fortunate that you have a husband that can afford for you to take time off if you need to, but not everybody has that luxury. So I thank you for letting me be a part of this. I will always say yes whenever you need me to. And I look forward to working with everybody really hard in the future to make this a national endeavor. Thank you.
Thank you, Stephanie. And I'm already putting an asterisk next to your name because I will be calling you again.
I'm always here. I'm always available.
Thank you so much. Thank you.
Thank you.
Next, I would like to introduce Chevelle Moss Savage. And Chevelle and I had a chance to chat just a little bit before we began today. And so I welcome you to tell your story about paid family medical leave and the difference it would have made in your life. So welcome.
Thank you. Thank you. Greetings, everyone. My name is Chevelle Savage, and I had the pleasure of serving on the board of directors for LCT, which is a 501c3 nonprofit organization established in 2013 for members of the LGBTQ community in Southeastern Connecticut to plan a new London Pride Festival. And we've done so much more since then. I want to thank the planners and advocates of this rally because it is so important and allows members of the LGBTQIA community to be considered as family units, when inherently that has always not been the case for so many reasons. In my, when I was thinking of what I was going to say today, I looked up the definition of family. And so Merriam-Webster definition of family is as follows: the basic unit in a society traditionally consisting of two parents rearing their children. Now, based on that definition in the dictionary, it appears in order to be considered a family, you have to be a parent. This is a very narrow definition, as a lot of you know. So my spouse and I are not considered a family because at that point in time, we didn't have any children. However, Connecticut paid family leave understands that families of all dynamics are important, which makes me want to share a personal story. Several years ago, my spouse had a medical emergency which required a higher level of care. So for that time, it meant that I had to be there to try to support her in every way possible. However, my employer at the time did not acknowledge same-gender relationships as family. This meant I could not take leave time to ensure she was properly cared for without the threat of losing my job, because our family dynamic was not considered a real family. And just to give you some context, my coworkers at the agency I was working at consists of married or partnered folks. So if one of my coworkers, husband or wives or partners, had a medical emergency, it was a given that they could request time off to take care or support their loved one. However, that was not my testimony. First, at the time, we were not married, so our relationship did not qualify for paid leave of a spouse or partner. And second, same-gender loving relationships were not legal in the state that we resided in. I'm originally from Virginia. You probably can hear my accent. I don't think I have one, but others say I do. And also, I was not out at work for several reasons. But none of those factors could compare to my angst about not being able to support my partner so she could recover in the best way possible. If family paid leave was available, that would have relieved some of my anxiety. And so I will close with this. The true meaning of family, the definition of family, are people who love and support you and allow you to be seen and heard. Some members of LGBT community are estranged from their biological family, and their entire support system is made up of chosen family. Paid family medical leave's definition of family would include those chosen family members, which for reasons I mentioned are paramount to the LGBTQ community. So paid family leave is just not the right thing to do. It's a social justice thing to do. And I want to thank you for allowing me to share my story.
Thank you, Chevelle. Thank you. That was just incredibly powerful. I appreciate you being here today. I do. So next I'd like to bring to our virtual stage Barbara Monk from AARP Connecticut. AARP has also been an incredible partner in making paid family and medical leave possible. We think about paid family and medical leave in many of the contexts and the stories that we've heard today, but very rarely do we think about paid family medical leave in the context of caregiving. And so that is where AARP has been an enormous voice and an effective voice in understanding how the law can apply to families of all kinds and all kinds of circumstances. So Barbara, welcome. And we're delighted to have you here today and for you to share your story. So thank you.
Well, thank you. I am just delighted to share the stage, so to speak, with so many wonderful, impactful women and leaders. I'm just in awe. As you said, I am a volunteer with AARP. I'm from North Haven, so it's nice to see Rosa, my congressperson here. And thank you for highlighting so much the importance of paid family and medical leave. I testified 2 years ago on this subject and was so pleased to see it passed. It was a very, very powerful day when we all celebrated that. I have been a family caregiver, basically at all stages of my life. And I would like to receive care from my daughter if I need it in the future. And since she's in the workforce, having paid family medical leave will allow her to help me as I see, as I've done before. I'm part of a team at AARP, a group of volunteers who present our Caregiving Roadshow to help families navigate their own caregiving challenges. There are a lot of us. There are about 459,000 Connecticut residents who are unpaid caregivers. Connecticut caregivers provide 427 million hours of unpaid care each year. This unpaid care is worth almost $6 billion annually, and that's probably going up, particularly because of the pandemic. And it includes helping recovering from serious illness or injury, assistance with activities of daily living, and providing support to help people stay in their homes as they age. This is so important. Most of us are, have been, or will be a family caregiver, or will ourselves need the help of a loved one to live independently. Family caregivers are really the backbone of Connecticut's long-term care system, because we've all found ourselves in that role. We're the first line of assistance for most people, helping us to make it possible for older adults and people with disabilities to remain at home and live with dignity and independence. As a mother, daughter, wife, and sister, I relied on others to help with caregiving. I watched my divorced parents care for my traumatic brain injured sister for years in their homes with the help of services during the day when they worked, and watched my parents juggle their work lives and neglect their own retirement savings to care for my sister. For example, my mother, the last years of her life, lived at Bella Vista in New Haven and had subsidized housing. Had she been able to fully participate in the workforce, she would have been able to contribute more to her own housing. My late mother had heart disease for 15 years and was diagnosed with dementia just months before she died in 2005. For over a decade, I set up pills, doctor's appointments, frequent hospitalizations, and coordinated her discharge care. All the while taking care of my own family. I had a daughter and a husband, and working full time. Bella Vista in New Haven provided a community for my mother, which was really helpful when I was at work, because I knew there were people who really were looking in on her as well. My husband, Don, would go do her grocery shoppings and sit and spend some time with her after he had retired for medical reasons, and keep her company. At the end, she required supervision, and since I was working, she did end up in a nursing home where she did die. I loved my mother, but it was physical relief that I was not balancing work, family, and care for her every day. Relief was short-lived. Less than 10 months later, my husband was diagnosed with non-Hodgkin's lymphoma. The cycle of blood tests, scans, chemo became almost routine and was repeated 4 years later as non-Hodgkin's lymphoma recurred. And this time a stem cell transplant and radiations were added to his treatment from the first time. And then 3.5, and that was good. It went into remission. 3.5 years later, however, during a routine scan, pancreatic cancer was found. So Adrienne's story definitely resonated with me as well. And he died 14 months later, because in most cases it is a death sentence. With the help of our daughter, good friends and neighbors, a flexible employer, and despite exhaustion, somehow we managed. I was lucky. I worked for an employer. I had sick time, I had vacation time. I did not have to worry about losing a paycheck or a job. That stress, along with the rest of just the stress of caring for an ill family member, is hard enough. It must be unbearable if you do not have the resources to do that, if you worry about losing your job. It's hard to do without some help. So this is why I was just so passionate about making sure that paid family medical leave came to Connecticut. It's important for here in Connecticut, for our nation, and for the world as we celebrate women on International Women's Day. Thank you.
Thank you, Barbara, so very much for sharing your story. Thank you. And finally, I would like to introduce Mike Flowers. Mike has honorably served our country and now works for the Department of Children and Families, and he will be telling his story. Mike, are you there?
Yep, I'm here.
You are. Welcome, Mike.
Thank you. I'll be brief and quick. I'd just like to say I'm in awe of the women that are gathered here today and their stories, and thank you for letting me partake in this. I'm the spouse of an active duty military officer, so I am a daily witness to a strong, resilient woman and how she navigates her work-life balance. I'll speak briefly. We've been all over the U.S. We came here to Connecticut about 2 years ago from Hawaii. When my wife leaves on her patrol, she's gone sometimes for months at a time, could be 6 to 8 months. So I'm usually home. We have 3 kids. And, depending when we travel from state to state, depending on where I'm working, I'm responsible for taking care of the kids, going to appointments, someone's sick, I've got to stay home. And as I'm sure everyone here knows, when you start a new job, you don't bring leave with you. So if I have to take time off, that's unpaid. So this Family Medical Leave Act would be great, for anyone, any military spouse, when they transfer into the state of Connecticut.
Thank you, Mike, so very much. And thank you and your family for your service to our country. We're really very grateful to you for that.
Yes, thank you.
Thank you. So you have heard from so many people today from all walks of life about why paid family and medical leave is not just a nice to have, but it is critical to our way of life and the quality of life that we want for every citizen in the state of Connecticut. I am proud to serve as the Chief Executive Officer of the Paid Leave Authority because I believe in the work that we are doing. And it doesn't take just my voice, but you've heard from everyone today how critical paid family medical leave is, the challenges that we have individually and collectively, and how this legislation can be absolutely life-changing. So if there is an opportunity to support paid leave, I encourage you to do so. I thank all of you for being here today. I thank all of our speakers for your support, Lieutenant Governor Bysiewicz and Congresswoman DeLauro and Representative Rojas and Councilwoman Bermudez for being here today. All of your stories were brave, they were moving, they absolutely illustrated why paid leave is so critical for the state of Connecticut. So let us continue to move forward. My staff and I will continue to do all that we can to make paid leave a reality in our state. We thank you so much for your support, and we're very grateful that you were here with us today. So thank you. We just finished. If you can hear me.
Andrea, do you want to terminate the meeting then?
I will. I want to just get TJ's attention before I do that, but I don't
Oh,
think he heard me.
sorry.
Sorry, TJ, we just ended. That's what I wanted to tell you before I turned
Oh.
the meeting. Yes. Yeah, that's what I was waiting for, Aaron. I didn't want to hang up on TJ. Yeah,
Oh,
we just finished.
I had it in my book to start at 11.
Oh, no, we started at 10.
Oh, geez.
It's all right. It's okay.
Did my foster family, I saw that Andrea had reached out to her Friday.
Was it Colette?
No, it was Lyna Harris.
Yes, Lyna participated from the field while she was great. She was great. Thank you so much.
Good.
Yeah.
That was the most important.
No, she was there and she was really terrific. So yeah, we'll be in touch again. I promise you.
Okay, of course. Anytime. And I'll be better at timing for some reason. I don't know why.
Okay.
All right. Thanks. Bye-bye.